morning, and you are very welcome to today's CBI at 10 webinar. My name is Kerry Thomas. I'm an editor at a new startup called Tortoise. Looking forward to the next 45 minutes in your company and the company of some experts that we've got with us today as well. It's another big day, isn't it? Another big day in the opening up of non-essential retail in England, leisure, hospitality, outside hospitality. I think all children are back at school in Wales. I think if you're on this call and you're involved in any of those reopenings, then I'm sure all our good wishes go with you, and we're looking forward to that continuing over the next few months. I think if I look back over the past year, it's interesting the way that testing has sort of come and gone in the conversation about lockdown and coronavirus. There was a period certainly late last year when we were obsessed with it because the test and trace seemed to be struggling. Was struggling, I think, to be fair. Then we turned our attention to the vaccine and probably didn't really notice when the test and trace scheme actually radically improved. And then more recently, it seems to me that testing has come back into focus through the arguments about COVID passports and the implications of that. But also, I think, because we've woken up to the fact that when we look forward to full reopening, I think we can now see how important testing and workplace testing is going to be to us getting back to normal life. So suddenly, I think testing looms very large, which is why it's important and great to have the opportunity over the next 45 minutes to talk about workplace testing here today with some people who can really help us, I think, get our heads around it. We've got delighted to have with us Caroline Makepeace, who is Deputy Director of Testing at the Department of Health and Social Care. Caroline, good morning. I'll come to you very soon. We've got Simon Rice-Birchall, who is a partner in employment law at Eversheds, who can help us understand some of the important legal implications of testing and the data collection that goes alongside it. And as ever, someone from the senior end of the CBI, we've got John Foster, who is Director of Policy and Communications. Come to you, John, in just a second. But as ever, the thing we want most on these webinars is to hear from you. So I think you know the drill. If you submit a question, there'll be a question button somewhere there on your screen. We will get through as many of those on this call as we possibly can. Those that we can't, I think the CBI will try to hoover up later on. And if you want to submit a question anonymously, then just do what you normally do and put a non at the top of the question, and we will deal with that confidentially, of course. But we've got a lot to get through, so let's kick off. John, good morning.
Morning, Kerry. How are you?
Very good. Good to see you. Let's do what we always do. Let's just look back over the last few days and see what we might have missed while we've been tucking into the Easter stuff and spending time outside. So, what have been the highlights of the last few days from your perspective?
Brilliant. Thanks, Kerry. Morning, everyone. Listen, I'll just start with obviously the sad news about the passing of the Duke of Edinburgh on Friday. Colleagues may have seen a statement from Tony on behalf of the CBI and the wider business community, just really reflecting that the Duke of Edinburgh was a real champion for UK enterprise across the world, and will be obviously warmly missed by the whole UK business community. Understandably, the government, as a result of the passing of the Duke of Edinburgh, have paused all activity apart from COVID messaging for the next 8 days, I should say, as part of a national mourning process. That does mean, Kerry, that the weekend was a little bit lighter on detail, new announcements, if you like, than we would traditionally expect. But just 3 quick things to run through with colleagues. So first and foremost, Kerry, as you mentioned at the start, today is obviously April the 12th. It marks the moving from step 1 in the UK government's roadmap to step 2. That means the reopening of non-essential retail, of hair salons, nail salons, barbers, and of course, pubs and restaurants with outdoor facilities. And as you said at the start, Kerry, wish colleagues in all of those industries the best of luck for today. Please do let us know how you get on. You also mentioned at the start, Kerry, what's going on in Wales. And actually, one of the questions that we do get quite a bit in our COVID inbox on these CBI at 10 webinars, what's the difference? What's the variation that's taking place across the UK devolved nations? Because it is quite a disparate picture, sometimes a bit tricky to unpick. So I'll just do 30 seconds on where we are. So on Wales, Kerry, from today, non-essential retail will be able to reopen. From the 26th of April, pubs, cafes, restaurants with outdoor facilities will also be able to reopen. Big day on May the 3rd for the gym buffs in Wales, you'll be able to go back. And then separately, 2 households will be able to meet indoors. In Scotland, you lucky people have been able to get a haircut for at least a week since the 5th of April. The next date in Scotland for the milestones is the 26th of April also, where all retail and hospitality will be able to reopen. And then in Northern Ireland, slightly trickier picture where the executive don't really have a similar roadmap to what we do have in England, but as of today, non-essential retail open for a click and collect service. And then the plan is from this Thursday, the 15th of April, the executive are meeting to detail what a roadmap out of lockdown might look like. Second bit of good news, Kerry, that feels like it's almost broken this morning due to some quick reports. It does look like the government, as of tomorrow, is going to move on to its next tranche of the vaccine programme. So starting on those under 50s. So the government having hit its target for all the over 50s, all the vulnerable groups by the 15th of April. So the vaccine juggernaut rolls on. I think long may it continue. And then really, Kerry, the big bit of news, the big bit of progress since we last met on Wednesday was the publication of the government's Global Travel Task Force. So the PM gave us a bit of a sneak peek last Monday, but on Friday we got the full report, we got the full details. And I think our assessment, if we're being sort of generous, is it's a bit of a mixed bag for industries affected by the reopening of international travel. So on the positive side of the ledger, Kerry, we do have confirmation of a traffic light system, which is going to categorise countries based on risk alongside the various restrictions that will be put in place for travellers. That's a good thing in principle. It's the risk-based approach that the CBI and other firms have been calling for. I think secondly, the announcement of a green watch list that will tell us what countries are at risk from sliding down from green to amber will be a real asset, both for consumers and firms alike. And then finally, the government has also been transparent on what are the data points that are going to be utilised for judging which country falls into which part of the traffic light system. And we know that there are going to be 4 in particular. So firstly, the percentage of the population that have been vaccinated. Secondly, the risk of infection. Thirdly, the prevalence of variants of concern within that country. And then finally, the country's access to reliable scientific data and genomic sequencing. But Kerry, and I think it is a pretty big but, the proposed testing regime, so PCR test, even if you're traveling in and out of a green country, even if you've been vaccinated, we do think are going to have a particularly tough element in terms of suppressing demand, because ultimately it's an extra cost that inevitably is going to be borne by consumers. Now, I think if you speak to anyone within the industry, there is an acceptance that with increased transmission, with new COVID variants overseas, that the government was always likely and was sensible to take a slow, steady, cautious approach. But given the time that the industry is going to need to prepare, it does, we think, raise pretty necessary questions about whether we need to reopen what support is going to be available to firms, particularly if their ability to almost trade their way into recovery is going to be restricted in the longer term. I think one final thought just before I pass back on to you, Kerry. Within the government's task force report, they do identify sort of 3 gateways, 3 checklist dates where they have confirmed that they will review the evidence, review the progress of the system. Now, those dates for people listening in are the 28th of June, the 31st of July, and the 1st of October. Now, our hope and our message to government is going to be this needs to represent the first step, not the final destination for reopening international travel. So use these checkpoints to work with the travel industry, to work with the supply chains, to work with the sectors affected by international travel, to really look at the evidence, to of course protect public health, but make sure we get the right balance around how we can reopen the economy safely and effectively. So that's a quick cant around the course of what we've seen over the last 7 days or so, Kerry.
Great, John, thank you, and plenty of stuff there for future webinars. But I think we're bound to get back into a whole host of those topics. But I think important now that we turn to today's topic and the question of workplace testing. Just staying with you, John, for a second. How has the CBI been dealing with government over this issue of workplace testing? How great has that dialogue been?
So the dialogue itself has been fantastic, and I think you're right, Kerry. This has been a topic that has sort of ebbed and flowed, but it does feel like it's really taken hold now. And I mentioned at Wednesday's webinar, colleagues may remember, I sort of described the Prime Minister's kind of 3 pillars around reopening. So firstly, the kind of world-leading vaccination program. Secondly, it does look increasingly likely that COVID status certifications in some form is going to play a part in terms of how do we reopen those harder to crack parts of the economy and society. And then finally, testing, where I've got to say the progress over the last 12 months has been absolutely extraordinary. The CBI have worked incredibly closely with the Department for Health and Social Care around implementing test regimes. Huge thanks to Caroline and to her team, to Ben Stimpson, who I know has appeared on this webinar a number of times. It generally feels like the department sort of values the input of business, both as a vehicle for feedback, but also as a delivery agent for testing. And that relationship, I think, has been sort of hugely helpful and advantageous. I think it is important to note, Kerry, that the testing regime has just evolved so rapidly from right at the beginning, when it was very focused on certain situations, certain sectors in particular, to now being available for a sort of array of numerous testing regimes. So we have workplace testing, which we've talked about time and time again. Colleagues listening in will no doubt have registered. We now have Workplace Collect, which allows firms to undertake at-home testing where it's not possible on site, and then community testing, which has proved, I think, a really vital outlet, particularly for smaller firms. And as of, I think it's this Friday, we're now going to have that kind of mass general population community testing where you can go and pick up your lateral flow tests either through Pharmacy Collect, the gov.uk website, or indeed you can pop on down to your local test and trace site at certain times. So as I said earlier, just extraordinary progress. Just before I pass back to you, Kerry, I think there are probably 2 challenges that firms listening in are really starting to grapple with right now. I think first and foremost, businesses want to understand how this jigsaw puzzle of testing that I just kind of very quickly worked through actually will operate in practice. In particular, how is this mass general population community testing going to interact with the workplace employer testing? That's probably question number 1. And then I think question number 2 is with a bit of a longer term outline. So we know that the support from the government for workplace testing is due to run out at the end of June. Now it feels like testing is going to be with us for a number of months to come. So firms are already thinking about their contingencies. What's going to happen when we hit that June sunset clause? And it would be just remiss of me, Kerry, if I didn't finish by just giving a bit of a plug on the workplace testing to say, I think I'm right in saying that today is the final day that firms can apply for the government support, April the 12th. So if you are still thinking, yep, workplace testing could be for me, listen to our experts, and then once you finish, go onto the gov.uk website, get your application in. Today is your final day for that. Thanks, Kerry.
I think you've got about 13 hours and 44 minutes to get your application in, something like that. John, that's great, thank you. And Caroline, let me come to you, because I think John has given us there quite a useful sort of map for the next few minutes here. So, but if I can give you a sort of broad opening question, when you're looking across the different components of testing that you're obviously putting in place at the DHSC, how important a component is the workplace testing piece of that?
Very important is the short answer, and thanks to John for the sort of canter through of the testing offer. I'm seriously considering hiring you for our future briefings because you do it so well. But certainly we see workplace testing, so accessing tests via your employer or whoever you work for, as being the primary route for individuals to access tests. So I think it's worth repeating that this is about testing regularly if you don't have symptoms. This isn't about if you've got a cough and a fever and I think I might be getting something. For that, absolutely, please go to a PCR site and get that formal confirmation. But for routine asymptomatic testing, absolutely, we see workplace testing as basically being the primary channel. And we think, I mean, certainly a lot of the companies that we talk to are really interested in doing that. They're interested in making sure that their workforce feels safe if they can't work from home, and that asymptomatic testing is a really important part of helping their staff feel safe and be safe at work. So, I mean, as John says, until the beginning of last week, in fact, we were only able to support companies to set up on-premises testing. So setting up a testing site and having staff come there, do their swabs and get their results. As of last week, companies can now offer home tests to their staff, so there's a choice there. We will send tests to the employer. They can either set up on-premises testing, or they can give test kits to their staff to take home and do there, or they can do a variety. We know that, you know, there isn't just one way of testing that's going to work for all of England's employers, which is why we're introducing this element of choice, and hopefully that's useful for employers. I recognise we're introducing quite a lot of choice all at once, and that's why some of these questions are coming up. But in short, one, we see workplace testing as basically the primary route, but we're introducing these new channels. So, for example, individuals being able to access tests via a pharmacy or to order a pack of 7 tests online. That's all about us making sure that we can reach everybody in England. So we know that if we only offer tests through employers, there'd be some people that we'd miss. There'd be some very small employers who might find it quite difficult to operate that. There'd be some people who aren't in regular work who might find that they're otherwise missing tests. So that's why we're introducing these new routes through pharmacy and through gov.uk to sign up directly. That's why there's the variety.
Okay, and Caroline, have you got a sort of hierarchy of preferences with it? So if an employer can offer testing in the workplace, if that's the primary route that you think these tests may be done through, is that the best option for people? Are they likely to be more reliable? Are they likely to be better conducted if they're done that way?
I think companies need to figure out the testing regime that works for them. Ultimately, I think we probably all agree that central government isn't necessarily the place that should be deciding on behalf of each and every individual company. But yes, we like to encourage companies to set up on-premises testing where they can. We know from all of our research that we identify marginally more positive cases through on-premises testing. That tells us that it's just a little bit more effective than doing testing at home. So yes, if employers can offer that, and this is something that you can work into their regular routine, yes, please do that. We think it's a really good thing to do. That said, we wouldn't be offering home testing if we didn't think it was highly effective and we didn't think it was a really good way of picking up those infectious cases that aren't showing symptoms. So for companies to decide really, but look at the options that are out there and talk to your employees about what they're willing to do and what they're up for. But yes, the choice is there to be made by companies.
Good. And just in case anybody hasn't picked this up along the way, what sort of facilities would an employer need to offer at work in order to conduct workplace testing?
So if we're talking about on-premises testing, the requirements are actually pretty simple. So you need a space, you need a table, you need staff to oversee the swabbing and to upload the results. There's the 6 basic things that you need, and we offer all the guidance on that. But ultimately, it's about having the space and having the workforce to be able to run that testing site. Those are the big things that you need to get sorted. If you're offering home testing to your staff, so you're just giving test kits to your staff, what we do ask is that you record the batch number of the test kit that you're giving out to the individual. It's just good practice. It's so that if there is, in the unlikely event that there's a batch recall or that we need to be able to trace test kits down to the individual level, that there's that data there. So we're not just throwing them out into the open and not being able to track them just in case something goes wrong. But on home testing, the requirements are very light on the employer. So it's really pretty easy to set up, which is good news, I hope.
I think it is, yeah. And I've just got a couple more practical questions before we come to Simon on some important legal points. Have you got a calculation of how long you would expect it to let's say with the on-premise workplace testing, how long would you have to allow sort of end to end for an employee to go in, be tested, upload the results and be done with it?
Well, the processing of the test itself takes up to 30 minutes. So that's the bit that we know, and the bit on either side of that very much depends on the working environment. And I mean, without wishing to be glib about it, how long does it take for the worker to get from where they've been working to the test site and back again? So that's very much sort of a company specific thing, but the processing of the test itself is up to 30 minutes. So it's quick. We know it's frustrating. It's half an hour out of the day, and we'd all rather not be doing it. But we are in the environment in which we are in, and in the context of the alternative being sending tests away to a lab to be processed and getting them back a day or two later, this sort of rapid 30-minute testing is just a world away from that, which is fantastic.
Yeah, and finally, how much confidence can employers have in the tests that are being sent out? Because there's been a lot of sort of lateral flow tests. They're not as good as PCR tests. Are they, are they really worth doing? How well do they perform now?
They perform extremely well. I mean, if they didn't, we wouldn't be rolling them out as widely as we are. As I say, there's the real benefit of lateral flow tests is the pace at which they can be processed and the fact that you don't need to send them away to a lab to be done. They've got an over 95% sensitivity rate, which means that there's a 3 in 1,000 chance of them falsely identifying a positive case of COVID. So it's extremely small numbers. It's very rare. Worth mentioning at this point, though, as we're on the topic, if somebody does get a positive result for a lateral flow test, whether they're taking that on premises at work, whether they're taking that at home, wherever they've got their test from, we do ask that person goes to get a confirmatory PCR to confirm that result, because of that very small chance that it could be a false positive.
Great. Caroline, we will come back to you. I'm sure there'll be questions, but thanks for that so far. Simon, thanks for your patience. Good to have you with us. Simon's from Eversheds. And you were on a call with us, I guess, a couple of months ago now, where we were talking, I think, mostly about vaccines. From a legal perspective, what do you think would be the substantial changes since we last heard from you?
I'm just unmuting. I think the first thing is the progress of the vaccination rollout. 32 million first doses as at yesterday, and nearly 8 million second doses. So obviously the whole society is a safer place by virtue of that alone. A word about vaccination. I know we're talking primarily about testing, but my overwhelming experience is that employers are not making vaccination mandatory. So just get that out there to start with. I mean, most employers are encouraging it, but aren't actually expecting staff to be vaccinated as a condition of attending work. Testing has without doubt become more prevalent, and employers really are faced with choices over testing. And there's legal differences between the approach that an employer might take. So, for example, the on-site mandatory testing where the employer collects the data is, from a legal sense, the most invasive. Whereas a voluntary regime at home, where all the employer knows about is whether or not the employee is in fact tested positive and therefore has undergone self-isolation. The latter has no collection of data and therefore, as I see it, at least no privacy issues. The former, the on-site testing, involves the collection of special category personal data. And the starting point is there needs to be good reason in order to do that. And we would say that the good reasons are that it's consistent with the employer complying with its legal obligation to keep a workplace safe. That would be one that is permissible. And the other, it could be argued that it's necessary in the interests of public health. So the reason is there, but it's not just about having the reason, it's about recording the reason and publishing the reason to the workers. And so we are advising that essentially COVID policies are developed which record the employer's reason for requiring the testing. And it's there for all to see, and that part of the process of developing such a policy, going back to what Caroline said, is full and open discussion dialogue with staff and getting to the bottom of any reservations that people may have. And just a final point on this, that fair processing notices, which all of industry is used to, are probably outdated, because when fair processing notices were put together, they wouldn't have envisaged almost certainly a COVID pandemic. So So it's a dual approach of updating fair processing notices together with producing a COVID testing policy, which is consistent with the approach the employer has decided to opt for.
Okay, Simon, there's quite a lot in what you just taken us through. So let's go over a couple of bits of it more carefully. So when you say special category personal data, that's a legal definition, is it?
It is, and it's to do with the fact that it's health information. Yes, so it's the highest, it's the most sensitive of data that an employer would, or anybody would routinely collect.
Yeah, and so what then are the implications of that over and above the sort of lower category data that employers might routinely collect?
Well, the implications basically are that the GDPR specifies a stricter regime for the processing of that data by virtue of the type of data that it is.
So more security and more capital handling, and
yes, absolutely. Well, the basis to be able to be using that data is completely different, which is why you heard me say earlier that we're having to look for pretty fundamental reasons, such as it needing to be necessary for a legal obligation or to protect public health. There needs to be a very significant reason why the employer should be handling this data at all. It's why a lot of employers are opting to go for what you might consider to be the lighter touch. I mean, Caroline said that it's marginally less effective. I don't know about that, but obviously it's being done at home. There's more vagaries in a system that's being done at home. But of course, the employer then doesn't touch the data. And in that way, from a privacy point of view, it's by definition less invasive.
So there's a legal incentive in effect for employers to prefer home testing over workplace testing potentially.
There could be, but balanced against that is the control that an employer would have in doing it on site, because the employer knows, firstly, that it's being done, and secondly, that it's being done properly. And I think that's a point Caroline would echo, that it's important that, you know, there's no point in carrying out a testing regime if there's holes in it somewhere. It's not that there's no point, but it's not as good as it should be. And there are obvious issues which can occur at home. For example, people forgetting to test is an obvious one. It's not about doing the test badly, it's just didn't do it.
Yeah, and I suppose, Caroline, just to come to you on that, it's possible that even if an employer could see what Simon has just said, that it might make their life easier to have these tests conducted at home. From the point of view of instilling confidence in a workplace, it might still be preferable to have it done on premises.
Yeah, it's quite possibly, and I think there's a route in the middle as well, I suspect, for companies who establish a routine with their workers, where the workers let them know that their test has been taken regardless of the result. I mean, of course, there's an implied result, I suppose, because if you're still turning up to work, we can assume that wasn't a positive result because you should be self-isolating in those circumstances. But yeah, I echo Simon's points that some of the reasons why testing is more effective when it's in a supervised setting, they're wholly human. It's because you need to swab for a certain amount of time in your throat and your nose, and it's not very comfortable, and no one really likes doing it. But if you're in a supervised setting, you're more likely to do it properly because there's somebody watching. If you're at home, well, the temptation to just cut corners a little bit, or to be distracted by the morning routine as you're frantically doing this whilst getting the kids ready for school and the dog knocks the test over. You know, there are deeply human reasons why taking these things at home, it's, you know, there's a faff element, and we can't rule that out, but it's all about finding the right balance for individuals and for companies to make sure that there is a way of building asymptomatic testing into people's routines, because we see this as a way of helping open up the economy, help open up the country, and look forward to a more positive future.
Yeah, Simon, let me come back to you, because you mentioned, well, actually, just a bit of terminology again. You mentioned fair processing several times in your earlier remarks. Can you just walk me through what that is and what the implications of fair processing are for an employer?
Yeah, employers are required to publish what we call fair processing notices, which are essentially the basis upon which employers will process personal data. And the particular category, special category personal data would be health information. And whether you are COVID negative or COVID positive pursuant to a test would, of course, be health information. And so what you're meant to do is to be very clear about the circumstances in which you would need to process that information, why you're doing it, what the purpose is, and also how you're going to go about it and how records, etc., will be kept safe around that. Now, so therefore, all employers listening will have, I'm fairly certain, GDPR compliant processing notices already. My point was that they wouldn't have been put together at a time when staff were being routinely tested, and therefore there's a whole pile of sensitive health related information suddenly loaded onto an employer who would never have had that information previously. The only time an employer would likely have known information of that type is in relation to those who have got some form of health condition, and which the employer is assisting the employee in managing. But now what we're talking about potentially, if it's a mandatory on-site COVID testing regime, we're talking about collecting data of a sensitive nature for every single worker. That's a different scale of requirement. So I was just mentioning, go back to the basic documents that are already in place and ensure they're fit for purpose to cover this scenario, which they won't have had in mind when drafting them.
Yeah. So really, if I take one thing from everything you've said so far, it's that for most employers, the existing data systems they've got in place are unlikely to be fit for purpose for handling the new set of data.
Yes, if they're moving to collecting the data. If they're doing the lightest touch approach, which would be the one we've talked about at home, then they're not collecting data at all because they don't know about what's going on unless an employee presumably self-isolates pursuant to a positive test.
Yeah, understood. Okay, you mentioned it in your last answer, that mandatory workplace testing, and you said before that most employers had, or you weren't aware of any employer, I think, who has insisted on vaccination as a precondition for people coming to work. What's the legal position with insisting on testing at work?
Well, my approach to that has been that it's for the employer to regulate how it goes about complying with its safety obligations in the workplace. And testing is relatively non-invasive, and the government sees it as a key feature of its COVID secure jigsaw. And so my advice to employers has largely been, well, not largely, has actually been that I can't see a justification for employees refusing to undergo testing. I just can't see how that, in the environment we currently live in, makes a great deal of sense. The problem about vaccination, of course, it's a completely different thing because it is more invasive. And by definition, suffering a consequence for refusing to take a vaccine, to me, is a different scale of intrusion than it would be to say, I don't want to take a swab test. I don't know what Caroline would make of that. I mean, would you agree with that, Caroline? It seems to me that a different scale of intrusion.
I defer to you on the details of the law, but yes, absolutely, that feels reasonable. I mean, I suppose we could all have a personal view on how invasive it is to stick a swab up your nose, but yes.
Yeah. Let me jump to you on that, John. So from your conversations with employers, do you think that's how they're approaching this question?
In what sense, Kerry?
In the sense that they will expect their employees to take these tests. They don't see, as Simon was saying, a reasonable justification, given the non-invasive nature of them, a reasonable justification for an employee not taking a test.
Yeah. So I think you're right, Kay. I think there is an expectation, but I think one of the first things that Simon mentioned, and actually this is something that we've seen throughout this particular crisis, is the strength of communication between employers and employees. So what we would say is actually just simply mandating someone to do something probably isn't the best way to make it happen. Actually, what you want is that classic sense of shared interest, and that comes from really good comms, real clarity, working in partnership, talking to unions where necessary, and actually that's been the strength of I think the response to this crisis, whether it be the COVID secure guidance or actually what we're seeing with testing. There will be some scenarios where the mandatory nature is required because of safety or whatever, but actually we think the best approach that we've seen so far have been when firms have sat down with their staff, talked to them openly, and that is getting the best responses.
And I think it might also be another reason why workplace testing on premises might be a powerful thing, because one of the things that's driven vaccinations is the sight of everybody else doing it, isn't it? It's a powerful incentive to people to join in if they can see that it's normal and everybody else is up for it. Caroline, let me come back to you. John mentioned much earlier on that we've got this deadline tonight for firms to apply. Just fill in the gaps there. Just what is the deadline at midnight tonight, and what do firms need to do in order to hit it?
So the deadline tonight is for registering your interest in workplace testing. This isn't the same as placing an order. This is just tell us that you might want to place an order. So gov.uk, if you go to, you can navigate via gov.uk/coronavirus. I'm sure the CBI have shared the link. In fact, I can see it's in the webinar chat. That's the direct link. It's a very simple sign-up process. All we ask is the company name and a couple of details. Press register. You'll get an automated response to say, yes, we've seen it. That's great. Thank you very much. That's all we need to know by midnight tonight. So nothing to lose as far as I'm concerned. I mean, I know a lot more workplaces will be thinking about setting up a testing regime, particularly with more businesses opening up today. So you still have time to think about what that testing regime looks like, I suppose, is one message here. Register and you lose nothing. If you don't register by the end of today, you will not be able to access the free tests from government. There are, of course, private providers out there, but this is just registering for the free tests that Test and Trace can provide you with.
Great. And just so I'm clear, registering doesn't automatically imply you're going to carry out the test on the premises. This could be this could be at home or at work.
Exactly. Registering tells us that you're interested as an employer in giving tests to your staff. You then have the choice, you as an employer then have the choice to decide, is that going to be on premises? Is it going to be home testing? Is it going to be a mixture of the two because of how your workforce is set out? You can make all of those decisions after today. That's absolutely fine. It's all ordered through the same service. It's just about, basically, it's just about coming through the front door.
Yeah.
Come on.
Have you been pleased with the number of people who've come through the front door so far?
Absolutely. We've had over 120,000 registrations so far, which is great. And we're working with all of those companies now to encourage them to place their orders and to get their testing regime set up and going.
Great, good to hear. We've talked a little bit about how the current scheme, I think, will run to the end of June. How long do you think workplace testing is going to be a thing? I think it could be quite a long time, couldn't it?
Allow me to consult my crystal ball. Yes, so government has.
Guessing.
Government has absolutely. We've committed to funding tests in the workplace until the end of June. Yes, we expect that testing will continue to be an important feature of our lives for some time to come. What that looks like in detail and for how long, I can't tell you that yet, and I suspect my public health colleagues also can't tell you that yet. But yes, we are expecting testing to continue to be an important part of how we fight this pandemic. And we're working very hard across DHSC, so across the Department for Health, and with colleagues across government to be clear about what the picture looks like beyond the end of June. But certainly the conversations that we're having with companies and with customers, as we see them at the moment, is we're having conversations about the value of setting up sort of the capability to test your staff in the workplace, a capability that you can ramp up or ramp down depending on circumstances. But we see that capability as being important, definitely beyond the end of June.
It could be a few years, couldn't it? All right, we'll put the crystal ball away. But let me come back, because I think the other thing I haven't picked up with you is another important thing that John raised earlier on, which is how the different elements of the testing regime interlock and how employers should think about. So I, as a private individual, I can go and pick up tests from pharmacy, from centres around the place. So there's that. How do you see the different elements working together so they don't clash?
Well, I think there are lots of different parts of the jigsaw, and there were two reasons for that. One is that we've been responding very quickly to circumstances and trying to set things up as rapidly as we can to make sure that people can access the testing that will be valuable. And the second is that there's lots of possibilities of ways in which people find it convenient to access testing. So that's the reason for there being lots of different channels as we see them live at once. So definitely from our perspective, we think that asymptomatic testing is an important part of what an employer can offer to their staff to keep them safe. So we think that it's hugely important. We would love to see employers continue offering testing and seeing themselves as the primary giver of tests to their staff. We have research that shows that a lot of people find it more convenient, frankly, to pick up a test from work or to take a test at work, because that's somewhere they'd be going anyway if they can't work from home. So we absolutely see sort of workplace testing as being the primary way in which people can access tests. There are other routes available, and this can be particularly valuable for some of the smaller businesses out there for whom either setting up on-premises testing can be very difficult, or for whom, frankly, the size of box of tests that we ship out from Test and Trace will be too big. So we say that we offer tests for companies with more than 10 employees. The reason for that is because the smallest box of tests we can ship is 378 test kits. That's the way our logistics route works. So that works for companies of a certain size, and it doesn't work for very small ones. And we know that, and that's why we've introduced these new channels so that individuals can access tests from a pharmacy, they can order them direct from gov.uk. Yes, of course, tests can also be picked up from a school. So there is an opportunity for workers and for employers to figure out what works best for them. And again, this comes back to the conversation where I think the most effective testing regimes between workplace and worker is where there has been that conversation about what really works.
Yeah, okay. Carolyn, the clock is going to defeat us if we're not careful. So I want to come back to you and then quickly to Simon to take us out. But just talk us through the implications of a positive test for an employer. Do I have to close my entire workplace? What happens?
If an individual gets a positive LFD result, we ask that they take a confirmatory PCR to confirm that's the case. The self-isolation for 10 days requirement is in place, as it has been for some time. And as usual rules apply, I suppose. If a worker tests positive, close contacts of that worker will need to take a confirmatory test. But one positive case does not mean that a workplace has to shut down. So it's very much standard rules of a positive test and close contacts needing to get a confirmatory test.
Great. Okay. Simon, I just wanted to come back to you just for some broad advice to employers who are wrestling with some of the legal questions you were talking about earlier on. If you sort of step back and say, right, what broad advice would I give to an employer who's thinking about implementing a workplace testing regime? Where should he start? What should they be thinking about?
I think that the starting point should be dialogue with workers to bring them on the journey from the very start. Some employers will prefer not, perhaps cultural reasons or whatever, will prefer not to have workplace testing, and prefer to have a light touch and for employees to carry it out themselves. Every single workplace is going to have its own culture, its own history, its own interface with its people. And I think that the employers should be led by what the feedback from the staff, unions if they're there. As John said, unions should be engaged if they exist in the workforce. But beyond that, to my mind, it's a matter of putting the documentation in place to justify the approach that's eventually taken. And that will vary according to the approach the employer takes and how invasive the employer wishes to be over what it implements. Wonderful.
That's super clear. Okay, as ever, we could have carried on for hours, but we have run out of time. So Caroline, Simon, John, thank you all very much. Given us wonderfully clear steers on, I think, what we need to do. Don't forget that deadline tonight. It's an important one, and as Caroline was saying, it just opens the door. It's not a commitment to going any further. We'll be back on Wednesday with the next CBI webinar at 10, and we look forward to seeing you then. Thank you very much.